Yes. Hello, my name is Jean-André Constant. I'm a doctoral student at the Cummings Institute for Behavioral Health Studies. My presentation is FQSCs can pick up the pieces. Federal feasibility of community-based management of sex offenders through FQHCs. My goal is to explore the feasibility of FQHC's involvement in community-based management and treatment of sex offenders through their integrated care model. My research method was a literature review through Deadline, Embase, Global Health, a site Web of Science, and Google Scholar. There are many myths and challenges to community-based management of sex offenders. My example is Sean, a middle-aged IT professional who has faced severe consequences following allegations of child pornography against him by the police, who raided his home and garnished his work computer 2 years ago. Since then, although not charged, he has been unemployed with no health insurance and no financial support. He admitted to grappling with pedophilic fantasies since he was a teenager. Still, he has taken measures to avoid potential harm to children, expressing deep remorse over his attractions. He was diagnosed with social and general anxiety disorders, and he has found some relief through treatment, helping him understanding the interplay between his disorders and his sexual inclinations, especially his condoning child sexual abuse by watching porn and accessing child sexual exploitation materials, CSEM. His situation mirrors that of many marginalized individuals and sex offenders facing a similar situation. Public misperceptions, myths, and stigma against sex offenders have driven the focus on incarceration over prevention of sexual violence. Sex offenders are one of the most feared, outcast, and marginalized social groups. Contrary to popular belief, 90% of child sexual abuse is committed by someone familiar with the victim. Sex offenders are portrayed as an homogeneous group. Myths about their moral character and treatability persist. This is my main findings. The multi-risk behavior change approach fixes sex offenders' needs due to their comorbidities, including paraphilia, depression, anxiety, CVD, and many socioeconomic challenges such as homelessness and lack of access to care. Sexual risk behaviors associated with smoking, alcohol misuse, and illicit drugs are very present among sex offenders. And according to Joel and Carpenter in 2022, there is frequent discordance between paraphilic fantasies and sexual behaviors, as high as 50% concordance rate. Incredible success rate of low recidivism has been demonstrated through community-based interventions. FQSCs can pick up the pieces. Why? They have a role to play by expanding sex offenders' access to treatment and meeting their healthcare needs in underserved areas. FQSCs have made an enormous contribution to reducing health disparities in the U.S. due to their fostering Medicaid expansion. Federally qualified health centers provide necessary services like case management and care coordination and prevention to address social determinants of health. 71% of FQSCs endorsed screening for social risk factors, which are the main problems of sex offenders. Thank you.